When you're seen for a thyroid nodule in our clinic, if the nodule is a specific size, typically over 1 centimeter, we may offer a fine needle aspiration biopsy. This is a test that is done in the office and considered an outpatient procedure, and no preparations are required. For those patients that turn out to have thyroid cancer, the treatment is as follows. First, the stage would be surgery. Surgery would be only involved of the thyroid itself. The voice box, swallowing, breathing, everything else stays intact. After surgery, we have to move on very often to treatment with radioactive iodine. This is a special form of radiation that is basically only used in thyroid cancer. After that, patient needs to be on thyroid hormone the rest of their life. I want to talk a little bit more about specific problems that you may encounter during those treatments and how it's followed up. First of all, I think it's important to realize when we talk about thyroid cancer that many people in the United States actually have had thyroid cancer. We believe it's about 300,000 people. The reason the number seems to be so high is that thyroid cancer is typically slow growing, so patients can often be cured or can live a long life with it, even with the cancer, without being bothered by it. So let's think about it. That's 1 in 1,000 people in the United States probably has had thyroid cancer. So it's a very livable disease, but you need to know specific areas about it when you undergo treatment. Let's talk about thyroid surgery. This should be done by an expert surgeon. And in thyroid cancer, only the thyroid will need to be removed, maybe with several lymph nodes. But the surgery typically is not very extensive and recovery should be quick. The more difficult period really comes after thyroid surgery, because most often you are not able to be on thyroid hormone, at least not in a full dose, and you are lacking your thyroid gland. That means in several weeks' time, patients will experience what we call hypothyroid symptoms. Those symptoms most often include fatigue, possible swelling, weight gain, constipation, feeling cold, sometimes hair loss. In general, the biggest complaint is really fatigue, sometimes to the level that a patient is unable to work. They're usually able to move around in the house and go shopping, but sometimes work is impossible due to the severity of hypothyroid symptoms after the thyroid gland has been removed. The next stage of thyroid cancer treatment is radioactive iodine. This is somewhat complicated if you're not used to it. Most people think about radiation treatment as going to a special place where you have to go 5 days a week, sit in front of a machine for several minutes or longer, and that's how radiation is done over a period of time. For radioactive iodine treatment, you get 1 capsule, 1 time that has radioactivity in it. You're asked to swallow that capsule, and the radiation goes through the bloodstream very quickly to the area where the thyroid used to be and causes its damaging effects there. The reason we do radiation iodine treatment is for 2 reasons. After surgery, there are still always some thyroid cells left that could be cancerous and could be normal, and it's best to basically kill those. That reduces your chance of thyroid cancer coming back, and it also makes it easier to follow up later with scans of the body to see if you're truly in remission. So talking about thyroid cancer, first going through surgery, then stopping the thyroid pills and being often what we call hypothyroid, then the period comes of that radiation iodine treatment. It is a little complicated to set it up specifically because we do this as an outpatient at our local hospital, usually Northwest Hospital. It requires coordination with them, with their pharmacy to order the radioactive iodine, and it needs to be delivered on a very specific date. And it also requires coordinating with our own time and ability to come to that arena. Because the treatment after the diagnosis of thyroid cancer is complicated with surgery, being hypothyroid for some period of time and needing the radioactive iodine is complicated, I want to kind of put things on a time schedule for you. Typically, if you've gone through surgery, you will be asked to not take thyroid pills anymore, usually 2 weeks later, which then leads to hypothyroidism. And those symptoms typically set in between 2 and 4 weeks, and it can last a total of 4 to 6 weeks in some people. Like I said, some people miss work because of it, and there's not much we can do about it at this point in time. The radioactive iodine treatment needs to be coordinated between you, the patient, the hospital, and our own schedule, and is usually done at Northwest Hospital. From our office, you'll be given a phone number to schedule this radioactive iodine treatment, and you'll be given a handout so we can tell you what to expect. The basic things you need to expect when you hear about radiation treatment and swallowing the pill and being basically radioactive at home is protection of others. The United States allows patients to go home with radioactivity in their system, but you have to take care that you don't contaminate other people. That is not as hard as it sounds. Contamination really comes from bodily fluids. It comes from the sweat, saliva, and our excretion products. So if we take care of those, the other people in our household do not need to worry. If we stay away, for example, for more than 6 feet, is also another way to protect the people in our environment. You'll be given a specific list of things to avoid and to do and to not do once you have received the radioactive iodine.